This is a story that came out on CNN April 17th, 2018. There's a 24-fold rise in organ transplants from drug overdose donors. Wow. But you know what? It shouldn't be too shocking, because if there's increased deaths, there's probably a lot of families out here now that are willing to donate. Person's not coming back anyway. So, and it wouldn't make sense, especially if you have people waiting and these people just died, and because of their age, their organs will probably still be intact. But let's go ahead and listen to this video.
Every 19 minutes, someone dies from an accidental drug overdose. Most of the time, it's from prescription drugs like oxycodone or hydrocodone. These drugs all belong to a family of drugs called opioids. They are prescribed to dull pain, but they also boost dopamine, giving some people a high. They can also slow down your breathing and are highly addictive. So why is it so easy to get hooked? Well, for one, your body can build up a tolerance, so that the more you use, the larger dose you need to get the same effect. Secondly, you can become dependent on them. In fact, your body creates natural opioids that are released when you hurt yourself. But if you habitually use painkillers, your body stops producing its own and relies on the drugs instead. If you try and stop then, the body goes through withdrawal. Consider this. In 2012, there were 259 million prescriptions written for opioid painkillers, nearly enough for every American adult and child to have their own bottle of pills. Look, we need to treat pain, but we also don't need to treat everything with the pill.
Okay, as you can see, things are definitely not getting better. Now, there's a 24-fold rise in organ transplant from overdose donors. So now what they're saying is, because the overdose deaths across the country are skyrocketing, people are now, families of the overdose victims have decided to donate their organs. So that has increased. So it went from 1.1% in 2000 up to 13.4% of those that die from drug overdose are now donating organs in 2017. The study suggests that the rise in organ donations from drug overdose deaths could help America's organ shortage. But it also shows between 2000 and 2017, many organs from overdose deaths donors were not used to save lives when they could have been. The current plague of deaths from overdose is a tragedy. It also could be tragic to continue to underutilize life-saving transplants from donors, said Dr. Christine Durand, assistant professor of medicine and oncology at Johns Hopkins University, who led the study. We have an obligation to optimize the use of all organs donated. The donor, families, and patients waiting deserve our best effort to every gift of life we can, she said. So it's probably one of those questions. You know how when somebody dies, and I know people went through this, the first thing they'll ask you, would you like to donate their organs? And you have the choice of saying yes and no. Now, in the case when my mom died, they did not ask that question, and that's because she had chemo. Once you have chemo, your organs cannot be used for transplant. So that was never asked. That's the one time they will not ask for a donation from that body. Durand added that there was no regulations specifically pertaining to transplanting organs from overdose deaths, could limit those organs from being used. But there are regulations related to donors at increased risk for transmitting certain viruses through organ transplantation. In our study, 56% of overdose death donors were labeled as increased infectious risk donors. I would imagine, because you know what? They got hepatitis C, hepatitis A, hepatitis B, HIV, and they have other like skin diseases and stuff. So, from all the injections, I would imagine, yeah, that is a huge risk. Even if, the organ was in good shape, you got the the big risk of a virus being attached to that organ. The donors required specialized testing for HIV and hepatitis, as well as specialized consent for the transplant recipient. There is a stigma related to this increased infectious risk label, Durand said. Yeah, I would imagine so. In reality, the increased risk of HIV or hepatitis in these donors is very low. I don't know. I don't know. I just don't. I don't know. I'm just saying, I personally would not trust an organ from a junkie, but that's me. As of Monday afternoon, about 114,746 people in the United States were in need of a life saving organ transplant. But between January and March, there were only 4,109 organ donors, according to the Federal Organ Procurement Transplantation Network. Wow, that's not many when you look at the number of people that are waiting. Those numbers reveal a huge gap between supply and demand. For people waiting on the organ transplant right now, I would like to think that our studies bring them hope that they could receive a transplant and have more donors that could help them, Durand said. I also don't want to lose sight of the people who made these transplants possible, the donors and their families, she said. In a time of greatest tragedy, they made a powerful decision to save the life of people waiting on a transplant. That means they are generous, compassionate people. Well, I don't know. They are people I admire. All right, so let me just go down a little. The study involved data from the Scientific Registry of Transplant Recipients, which included information on donors, wait lists, candidates, and transplant recipients between January 2000 and September 2017. The researchers identified 7,313 overdose death donors in the data who had at least one organ recovered during that time. There were 19,897 transplants from those donors. The data showed that the number of overdose deaths donors increased by 17% between the year 2000 and 2017. In comparison, over that time, the number of trauma death donors increased by 1.6% per year, and the number of medical death donors increased by 2.3%, per year. All right, y'all. Try to quiet down my phone here. All right, so a trauma death donor could be someone who died from drowning, gunshot, asphyxiation, among other causes. A medical death donor could be someone who died of a hemorrhage, a stroke, or heart attack, among other causes. Okay, the researchers found the number of overdose donors climbed from 66 in 2000 and the national pool to 1,263 in 2016 and By 2017, 915 in the first 9 months. Okay, so it goes up every year, and it makes sense because the drug deaths, they actually go up every year too. All right. The researchers also found that in 2016, overdose death donors accounted for at least 10% of donors in 29 states, with the highest percentages seen in Massachusetts at 35.6%, New Hampshire, and these are the states that have off the chart overdose deaths. New Hampshire at 32.4%, New Jersey 25.7%, New York at 23.1%, and Maryland 22.7%. All states that have a high number of opioid deaths on a regular basis. Overall, the researchers found a 24-fold increase in overdose death donor transplants from 149 in 2000 to 3,533 in 2016. Patients who received transplants from these donors had excellent outcomes. Patient survival and organ function were similar to cases when donors died due to trauma, and similar or better than cases when the donor died due to medical causes of death, like heart attack or stroke, Durand said. Okay. All right, so let me just go down a little. During the course of the study, the researchers identified 1,665 kidneys, 501 livers, 117 hearts, and 23 lungs from overdose death donors that were recovered but discarded. Wow. The organs were discarded at a higher rate than those from trauma death donors, but lower than those from medical death donors, the researchers found. For instance, kidneys were discarded at a rate of 14.1% among overdose death donors compared to 8.8% among trauma death donors, but 26.1% among medical death donors. This discard was primarily related to an increased prevalence of hepatitis C. Damn. So they donate, and then the organs ended up getting discarded because it was infected with hepatitis C. Man, see, that's because the junkie, and the drug addiction and them spreading it through sex and saliva. Okay, so hepatitis C infection among overdose death donors and increase infectious risk, Durand said. With transplant, you always have a balance, the risk and benefit, she said. Patients and their transplant teams have to weigh the small risk that an infection like hepatitis C, for which we now have a cure, against the risk of dying on the waiting list. Wow. Okay, so treatment for hepatitis C, they have something called Marviret, a treatment option for adults with hepatitis C, a course of treatment. And it costs, wow, the treatment for hepatitis C is $13,000. Oh my God, that's a lot of money. Woo, that's a lot of money. Wow. The study had some limitations, including the researchers were unable to determine how many of the overdose death donors died specifically of opioids versus non-opioids. I don't know. How do you determine that? Through testing, not unless you know prior to the person dying, but you won't always know that because some of these people die in the streets. Yeah, I mean, I don't know. I don't know, y'all. You know, what do you think? I think that taking organs from a junkie, that is a huge risk. It is a huge risk. I don't know if I would risk myself, but I don't know. I guess if you're on a donor list and you're just desperate to try to get another chance to live, I understand. You know, mm, it's in my opinion not coming from a good source. That's all I'm saying. Underutilization of organs from these donors still occurs and is probably underestimated in this paper by looking at discard rates, since this does not account for organs that are never procured despite the possibility of providing benefit to potential recipients. Wow. We need to save more lives of people waiting organ transplant, she wrote. The transplant committee should understand these new data and forge forward towards better transplant outcomes for more recipients. So I don't know. I mean, I can't blame somebody for taking the chance, if especially if like the kidney or heart they have, they know they can't live too much longer with it. I guess I understand, but boy, I just think it's a huge risk taking anything from these junkies. And that's just my opinion. But please tell me what you think in the comment section. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family. And don't forget to go out there if you have an Android and get my latest app that is in the Google Play Store. And you should see the link in the comment section where I have it pinned. Peace, family.